Hello, my name is Amanda Harris. I'm a student at Parkland College. Today I'd like to do my competency video for administering a dry powder inhaler, Advair. The first thing you want to do is review the patient's charts and go over the doctor's orders. You always want to perform proper hand hygiene. Hello, my name is Amanda. I'm a student, respiratory therapy student. Would you please verify your name and date of birth for me? Okay, thank you, Mr. Wilson. All right, first thing I want to do is get your pulse and your respiratory rate. Okay, how would you do that? You would feel for their pulse, you would count for 15 seconds, multiply that number by 4. Same thing with the respiratory rate. Watch the rise and fall of the chest for 15 seconds and multiply that by 4. Next, we're going to listen to breath sounds. You're going to do 3 sights on front, 4 sights on back. You're going to work your way left to right from top to bottom. Okay, I need you to breathe nice and deep for me. All right, let's get back here. Okay, nice deep breaths. Doing great. Okay, keep with the nice deep breaths. All right. Hey, Mr. Wilson, a little wheezy there. Do you remember how to do the huff cough? That's the kind of get everything, get them secretions moving up. Why don't you see if you can get some of that out of there for me? All right, just give me a good cough and spit it out. All right, thank you. Okay, the next thing we're going to do is a peak flow test. Do you remember how to do that? Okay, this is the one here where you're going to breathe out, get you in a nice deep breath, and then blow forcefully into this. Okay, remember we'll put this attachment on. Take a nice deep breath, wrap your lips around this here, blow out. Okay. Okay, so after your patient does that, we are ready to move on to the medication. All right, so today the doctor's prescribed you this dry powder inhaler. It's a viscous, it's Advair. This is not a fast-acting inhaler. If you're having an asthma attack, you're having trouble breathing, this is not the one to use, okay? Very important. I want you to be safe. This is a maintenance drug, okay? You do not use it for that. Okay, a couple other very important things is there's a counter on here, okay? When you open this disc up, the number is going to go down and it's going to click. When that number goes down and it clicks, then your medicine has been loaded, okay? Now another thing, listen. Okay, and the other thing is when you get down to about a 9, you're going to make sure you contact your physician and you're going to make sure you have another prescription waiting for you at the pharmacy because you don't want to run out and you don't want to wait till last minute. Okay, so you opened it up, you heard the click. Your medicine is now sitting in this chamber. Now there's a second click you're going to want to make happen. Take this, pull it down. Hear that? That means your medicine is now ready to be inhaled. This is a breath activated. There's nothing to push. You're just going to suck the medicine out. So remember, there are 2 clicks. The first one, open, counter goes down, clicks, medicine's ready. Second click, the medicine's ready to be inhaled. Okay? So you turn this, and now I want you to put it, exhale, put this to your lips, and draw in. Suck the medicine out of there. Okay? All right, so when you do that, get it in, you want you to hold it for 10 seconds. Or longer. The more time it's in there, the more it can go, but hold it as long as you can and then blow out. Okay? And then you would just close this up. All right? This medication, I'm going to need you to do it 1 inhalation twice a day, 12 hours apart. So just do it morning and night. Another very important thing is that this has corticosteroid in it, so it can actually give you thrush, and you don't want that. It's very uncomfortable. So you're going to want to take a drink. So, just rinse and then spit back in the cup and throw it all away. You do not want to swallow any of this. So rinse and spit. Okay, now what I want you to do is take your first dose. I want you to show me from beginning to end. Tell me the 2 very important things I told you about it not being a rescue and about watching the counter to make sure you have the other one. Okay, so after the patient shows that they know their dose, when to take it, and how to take it, then you're going to go ahead and reassess the patient. You're going to do their pulse, you're going to get their respiratory rate, you're going to listen to their sounds, and again, you're going to do a peak flow test. Okay, after that, remove your gloves and do proper hand hygiene and go put it in the charts.